Good morning, Dr. Sterling and classmates. So, the topic that I choose to speak about is the mental health condition as and sleep disorders. So, the common sleep disorders include insomnia, difficulty falling or staying asleep, hypersomnia, excessive daytime sleepiness, and sleep apnea, Airflow is limited while sleeping, causing low oxygen saturation and disruptive sleep. So many important physiological changes take place in all body systems and organs during sleep, but with insufficient sleep, physical and mental health problems. For example, symptoms associated with insomnia, such as prolonged sleep latency, problems maintaining sleep and an early morning's awakening are associated with an increased risk of illness, cognitive impairment, lower productivity, and mental health problems. The risk of insomnia was graded in women, and the risk of sleep apnea was graded in men. So other researchers show a higher risk of insomnia in women than in men. Studies have shown that women experience unique hormonal changes that increase the risk of insomnia. Women are more likely to recognize sleep disruptions and report these problems, and are also more likely to seek professional help for sleep issues. So research has also shown a higher risk of sleep apnea in men than in women. The reasons why men are more prone to sleep apnea than women may be due to differences uh, in obesity, upper airway anatomy, breathing control, hormones, and aging. So married individuals have a higher risk of sleep apnea, which is likely because the problem is more commonly identified when there's a sleeping partner present. So having dependent children was negatively associated with sleep apnea. These results is unclear. Nonetheless, the risk factors for sleep apnea may be associated with a lower likelihood of having children, possibly contributing to this result. So, obstructive sleep apnea is a common sleep disorder, which is characterized by intermittent, partial, or complete upper airway obstruction during sleep, associated with intermittent hypoxemia, recurring arousal, the sleep fragmentation, and poor sleep quality. The prevalence of obstructive sleep apnea with accompanying daytime sleepiness and approximately like 3 to 7% for adult men and 2 to 5% for adult women in the general population. So factors that increase susceptibility to the disorder include age, male sex, menopause, obesity, craniofacial abnormalities, family history, and health behaviors such as cigarette smoking and alcohol use. Um, so patients with obstructive sleep apnea may present several typical symptoms, including habitual like snoring, like often disruptive to bed partners, feeling of unrefreshed or awakening, excessive daytime sleepiness, or fatigue, lack of concentration, memory impairment, and at times psychological disturbances. So, even though a relationship between the severity of sleep respiratory disorders and excessive daytime sleepiness has been observed, recent studies point out that this relationship is is poor, right? So symptoms of cognitive and emotional disorders are accompanied by cardiovascular impairment that may eventually lead to more serious conditions such as hypertension, arrhythmias, coronary artery disease, or stroke. Right? So the causes of or the etiology of the sleep disorders from psychosocial perspective. is referred to the mental health conditions such as depression, for example, may indirectly influence sleep apnea by increasing the risk of obesity, physical inactivity, consuming too much caffeine, smoking, and heavy drinking. So sleep problems are associated with numerous complaints in social psychologies, psychological and physical health, and should be considered as an influencing factor in developing suicidal thoughts or suicide attempts. Although it is unknown whether insomnia symptoms lead to decreased mental health or whether mental health problems lead to sleep disorders such as insomnia in university students, for example. The results of this study reveals that sleep problems, especially insomnia, are a problem for university students to the same extent as in the general population. So sleep complaints are strongly related to clinical manifestations of um, psychogenic disorders such as depressive symptoms and emotional ability, as well as the presence of chronic diseases and a bad health perception, useful for promoting health wellness initiatives in public health and clinical practice. So, one assessment instrument that is used for to study the sleep disorders, we can talk about the Epworth Sleepiness Scale. It's used to examine daytime and sleepiness. So, this scale consists in of 38 items, rated on 5 points Likert scale, with higher scores on each subscale indicating more severe fatigue. This questionnaire is specifically developed to measure the multiple phases of fatigue following acquired brain injury. So the research findings on the evidence-based treatment of the sleep disorders, we can talk about when we apply current research findings on evidence-based treatment of this disorder, of the sleep disorder. So stress is possibly associated with insomnia and sleep apnea, with the association, right? With the association stronger for insomnia and a bidirectional association is more likely between a stress and insomnia than between a stress and a sleep apnea, where stress is more likely to result from a sleep apnea rather than cause it. So the positive association between stress and sleep apnea is greater than in singles and married people. Singles than married people. So possibly this is because married individuals are more likely to adhere to overnight treatment, and because singles who have been divorced are more likely to have sleeping disorders, which may have contributed to a stressful divorce. Okay. So, keeping up with the evidence-based treatment of the sleep disorders, so we can talk about the stress alone has a stronger association with other mental health problems than sleep disorders alone. And the combination of the stress and the sleep disorders has the stronger association. So bipolar disorder, for example, are more strongly associated with stress and sleep disorders than other mental health conditions. Another example is schizophrenia is more strongly associated with a combination of stress and sleep disorders than the other mental health conditions. So, the presence of depression was associated with female sex, older age, higher plasma brain natriuretic, peptide level, lower glomerular filtration rate, and the prevalence of heart failure. So overall, 46 46.5% of patients were categorized as having poor sleep quality. So depression and anxiety are common mental health problems that are strongly associated with sleep disturbance. So sleep recovers to the wake state, and it has a relevant impact on physiological activities such as cognitive or emotional behavior, cardiovascular function, and pain perception modulation. So sleep is also a wellness domain, and it is perception. Its perception impacts one's health status, being associated to mortality and morbidity in this as soon as it is a focus on of health promotion in the world. Um, so the psychosocial obstructive sleep apnea related disturbance may include like difficulty concentrating, cognitive impairment, depression, and a general decrease in daytime quality of life. Nonetheless, it should be acknowledged that the association between the obstructive sleep apnea and depressive symptoms may also be influenced by uncontrolled confounding factors, including obesity, age, sex, and hypertension, right? So, try to conclude this topic. We can like finally refer that sleep disorders have short and long-term repercussions on body systems such as physical vigor and cardiovascular disease in elderly people, for example, and social situations in which other individuals need to respond appropriately, right? So additionally, sleep restorative function deficits related to poor sleep habits cause fatigue in daily activities, for example. So international estimates like indicate that sleep wake, right? The sleep wake cycle disorders reach all age groups and genders, but they seem to manifest distantly in life cycles mediated by contextual and behavioral and mental disorders. Uh, so, we can briefly conclude that stress and stress-related sleep disorders are temporary reactions to external factors, which characterize bipolar disorder. For example, both bipolar disorders and schizophrenia are associated with psychosis, for example, right? And severe stress and sleep disorders can cause psychosis. This is just an example of which or the mental health conditions that could be worsened, like the sleep disorders or the characteristic of this the schizophrenia related to the sleep disorders, right? So this will be everything from this topic. I appreciate your attention. This is the reference that I use for try to summarize the main characteristics, the main causes of the sleep disorders, and how it affects to the mental health in general in all kind of population, university students, um, elderly people, people with mental disorders like schizophrenia, right? So the sleep disorder have many phases as well, the awake and the sleep cycle, as I mentioned lately. And this is the way we can like measure how we can alleviate or we can help this population of these people who have this kind of disease. So thank you very much, and well, I hope you have I hope you like it and feel identified in some of the if